We'll turn it over to Sherry Schaefer. Sherry, thank you so much for joining us as well. You're with TDS or RK Tongue Insurance. So to talk to us about insurance, but it sounds like you've got a topic that's a little bit different. It's not your usual pricing on malpractice insurance, but you've got a different angle, which is something our members might not have thought about. So I'll turn it over to you so you can talk with us about that.
Okay, very good. Let me pull my slide deck in and share my screen with you. Anything is exciting is savings, unfortunately. Everybody likes to save money. But insurance
staffing is a big topic now too. So
it really is. One of the key points in my slide deck is that I understand that employee benefit hygienists are in high demand right now.
they very much are. They have been for the last couple of years, and that remains the case in DC as well as nationally.
Wow.
So we're seeing your desktop as well as your slides.
Yep, you should just see it, my slide now.
There you go. Yep, perfect.
Okay, wonderful. So my topic tonight was what benefits could you be offering to retain great employees? There are a lot of different angles that we can take with this to help any dentist office with their customized needs. Before I get into the meat and potatoes of that, though, I would really like to share with you a little bit about who RK Tongue is. We are actually endorsed, obviously, by the DC Dental Society, but also the Virginia Dental Association and the Maryland Dental Association. We've actually been in business since 1911 and had a strong presence in the dental space since the late 1960s. Then we are also the exclusive program administrator for the Professional Protector Plan, Dentist Malpractice and Office Insurance Program in Maryland, DC, Virginia, and Delaware, and exclusively in other states and throughout the country. And then we have expanded into other markets in recent years. I'm going to touch on that real quickly before I get into my presentation topic, because I'm not sure that it is common knowledge that RK Tongue, because while, you know, you can pick up the phone and you call DC Dental Society and say, you know, I need professional liability, who do I call? And they say, call RK Tongue. But in the last 20 years, RK Tongue has expanded into other markets, including personal lines. So I'm going to talk to you today primarily about the employee benefits, and that is the expertise that I bring. However, I'm not the jack of all trades. We have someone that you would be referred to if you contacted me for any of the other lines. So we can help with all of your everyday business coverages, from your professional liability, your business income or interruption, license defense, commercial umbrella, and so forth. Cyber liability, unfortunately, is a big one these days, especially when it comes to your HIPAA requirements and protecting your patient's personal information. And then, of course, with personal lines, we can not only help you as the dentist, but we can also help your employees for some of their individual needs. We can shop their auto, their home, their individual life insurance, boat, umbrella, and the list goes on. You can see we can basically insure anything that they have a need for. And then I'm going to touch on how we can help with group health, vision, disability, long and short term, group life benefits, voluntary, and 401k. So why would we offer benefits? Well, we want to attract quality candidates, and we want to retain the great employees that we already have. Recruitment costs are going up yearly, just like everything else. And we don't want to find great employees only to lose them and have to start over again. We want to keep the entire staff healthy and productive. So if they don't have health benefits, they don't have the coverage to be able to go to the hospital when they're sick, oftentimes they don't take the time off and take care of themselves. It may only be an afternoon to see the doctor. They come to work sick, and then that spreads throughout the office. And then we've just been through COVID. That's the last thing that we need. And you want to stay competitive. And again, that's when I touched on the shortage of hygienists that I'm hearing about. That seems to be all the buzz that I am hearing when I speak to offices lately. So there was a recent survey conducted by SHRM, which is actually the Society for Human Resource Management. And they put out the top 3 benefits that employees stated that they want. The first being employer-sponsored healthcare, life insurance, and then retirement. Medical, whether you offer it or you don't, I'm sure you've had the conversation with your peers, with your employees, with your broker. Seems to be a necessary evil these days. But the DC Health Link actually makes the process a lot easier than in a lot of other markets. We can go down to groups as small as 2. That would include yourself as the owner and then 1 full-time employee. We can customize the plans to suit your individual needs. We can work with you to help put in place HSA compatible programs. And then of course, we are soon to come up on our federal special open enrollment time. The reason that it is so important that a lot of employers are aware of this open enrollment period, because if you put a plan in place in 4th quarter for effective 1/1, they will waive their enrollment minimums and the employer contribution requirements that are in place if you place a group medical plan any other time throughout the year. Now, one of the nice things that DC Health Link allows you to do, instead of having to choose a plan or 2 to offer your entire office, every single person in your office can go on DC Health Link and select their own plan. So you could have 5 total people in an office and every single person could have a different plan. We can quote with all of the large carriers. I just named a few here that you would be familiar with. It's usually the carriers that offices ask me to quote. And then we don't just set you up and roll out never to be seen again. So we'll assist you with the implementation and the onboarding. We can do that digitally or on paper. We have lots of people that still like their paper enrollments, but the DC Health Link actually makes that process a lot easier. So even if you're not tech savvy or digitally inclined, we can typically walk a group through that enrollment, and it's very, very easy through DC Health Link. If you're unhappy with your broker, maybe you never hear from your broker, it is super easy to switch. And again, that is an amenity that you have in DC that really gives you a leg up on some of the other markets and the availability that they have. Short and long-term disability. Now, I have offices place this with group medical. I have offices that don't offer medical that look into placing disability. A couple of reasons for that. These policies can typically be placed for pennies on the dollar. It alleviates the financial burden, not only to the employee, but to the employer. Should an employee suffer from a sickness, have an injury, maybe need a surgery, need time out. And one of the big ones I hear in the demographics, typically in a dental office, is maternity leave. And I've had dentists tell me in the past, you know, this person has been with me for 7 years and they're like family, and she's going out on maternity leave and I feel like I need to help cover that cost, or maybe I want to cover, but I can't because I need to bring a temp in. So if there's short-term disability in place, there's coverage for maternity leave, and they'll give you 6 or 8 weeks depending on delivery terms. And then long-term disability can actually give coverage up to 24 months, and it picks up where short-term leaves off. We also only quote with some strong carriers that are in the market, such as Unum, Guardian, and Lincoln Financial. Group life insurance. Again, this is a super affordable, pennies on the dollar benefit that you can offer that a lot of people just do not have outside of the coverage that they get through their employer. It alleviates the financial burden of the family in the event of someone's untimely death. You can offer a flat amount. Typically, I see $25,000 or $50,000 as a flat offering, or you could even choose to do a salary match. They're guaranteed issue. And then there's also spousal independent coverage. So when an employee enrolls, they can also enroll in an additional coverage that they pay for themselves. And then that allows them to sign up for an additional policy for their spouse and their dependents. Voluntary benefits. So I'm sure everyone's heard of Colonial Life or AFLAC. Our people take the duck around everywhere they go when they do their presentations. And basically voluntary benefits are going to give an additional layer of financial protection for the employee and their family in the event of a serious illness or accident. So voluntary benefits work a little bit differently, as they do have to be offered in an employer setting, but they are not employer paid. They are an employee paid benefit. They're very affordable as well, and the employee can decide if they'd like to take part in an accident, hospital, maybe a cancer policy, if that's something that, you know, genetically in their family, high risk, they might want to have a cancer policy. There's critical illness, and now they're even offering a lot of pet insurance options. And one of the things I hear is during COVID, so many people that were home ran out and got pets and they may not have been pet owners before. Pet insurance is actually much more affordable, just like it is for people when you buy them when the pets are younger, instead of running out and trying to put that in place when they're getting older and starting to cost a little more. Now, again, with these policies being employee paid, they still do have to go through the employer to get access to them. And then they are portable for the employees. So if they do leave and they're willing to continue to pay for the program, they do take the benefits with them. So my contact information is here. If you don't want to take down the Calendly, which gives you access to my calendar to jump on it at any time, that works for you. You can also email me and I can send you back the link, and we can schedule a one-on-one call, whether that is to review the benefits that you offer, how we could quote and show you what it would cost for any of the additional benefits, and really just work to customize what you're offering to be competitive in the market for your staff.
Well, Sherry, thank you for walking us through these offerings, and it's interesting to bring the employer perspective and the benefits that our member practices can offer to their staff. Are there any questions from the audience for Sherry, first of all? And Sherry, maybe if you also want to put up on screen again that early slide where you had the different categories of insurance and benefit programs, just to make sure everyone's aware of those as well, because that may be something that they're not conscious of. And these are the personal lines. Are those available to everyone, or those through the employers as well? Or
No,
both?
they're available to anyone.
Okay.
Yeah, and we have a lot, like I said, we've been in the dental space for quite some time, and that is RK Tongue's, I guess you'd say, meat and potatoes. And we have a lot of offices that we start out when they go out on their own, or they graduate from dental school, or maybe leave a group practice and start their own. And we help them with the liability and the disability and the work comp and all the things that need to be put in place just to function and be a running business. And then as they grow, we can meet with them, whether it's twice a year, once a year, anytime they call and say, I need help, come see me. And then we can sit down and say, okay, now it's time to start hiring. What do we want to look at? And we can stair step any benefits that you want to put in place. I know typically everyone says, oh, medical insurance, and it's so expensive. But we can start out with disability coverage. Or typically when I quote a medical plan, I just quote the disability along with it to give everyone an idea of what it is they're looking at for their office. When it comes to the small group space in the medical insurance, there's not a lot of flexibility with the rates. They are placed by the carriers. They are what they are. So where we differ is, since, I can't change those rates, and we can't offer, a coupon or a special, buy through RK Tongue. But what we can offer is that specialized attention. Someone's going to pick up the phone when you call. You're never going to be given a recording. We turn around call time. Should you have to leave a message, maybe your particular person that can help you is at lunch, they're going to call you back today. They're never going to ignore you or put your group in place and then not hear from them again. We're here to be a resource and to help walk you through any of the processes, whether it's filing a claim or putting a liability plan in place or growing as your office grows with your team. And that's where RK Tongue really stands out as far as the service that we provide. And one of the things I didn't touch on is that, and I'm not sure why they don't talk about it a whole lot, but our president is also head of Gerner Financial. So he's a certified financial planner, and we can help on a business level and on a personal level as well. And even work with your employees, because sometimes you don't always know where to go. Like everyone knows that they need, they need a financial plan, but who do you call? Well, it's a lot easier to call someone that you've been working with and you trust.
I think that is fantastic that you offer that kind of services, because sometimes they don't know when to go, and we as employers, we don't know what to send them. So it is important to know that you have the services for us. Thank you.
You're very welcome. Thank you for the feedback.
I guess I'll ask for a last call for questions and comments. Dr. Berman, thank you for sharing that comment as well. And Sherry, thank you so much for joining us tonight.
Thank you for having me. I really appreciate it.
Yeah, this is interesting, and we'll make this recording available. If you're able to share any materials afterwards, whether this is slides or supplemental materials, we can make those available to members as well.
I'll send you a slide deck.
Great. And I just want to highlight for everyone that this is not the end of the series. This is something that's experimental, just to make sure that members are aware of the benefits and programs available to them. But the next sessions are scheduled for August 16th. We have one at 12 noon with alternative systems that talk about 3 simple things to protect your practice from cyber attacks. A big topic now, cybersecurity. And then the evening of the 16th, we'll have a presentation from Best Card on reducing credit card processing fees and overhead. We'll return with our continuing education program in September. The first event is on Thursday, the 14th, and it will be virtual, but we will have an important bylaws vote at that meeting. So I hope you'll be able to participate. And then we'll return with in-person meetings in October. Everyone, thank you for joining us tonight. Have a wonderful summer. Be safe and enjoy some time off, so hopefully as well. Take care.
Thank you very much.
Thank you so much. It was great.
Thank you, everybody. Bye-bye.